The Ambu AuraGain is a second-generation laryngeal mask for all airway management needs. The AuraGain provides superior seal pressure and offers an array of integrated features, making it the safe choice for routine as well as more advanced cases. AuraGain integrates gastric access and intubation capabilities, which are designed to dramatically improve patient safety and airway management efficiency. Depth and navigation markings along the length of the device facilitate smooth and easy placement in the airway, as well as enabling the placement of endotracheal and gastric tubes as needed to assist in procedures. The unique device design offers high seal pressures, up to 40 cm H2O, and also allows for use as a conduit for direct endotracheal intubation. Furthermore, an integrated bite block and pilot balloon help prevent airway occlusion and provide tactile indication of the device's cuff pressure. The anatomical curve of the AuraGain facilitates rapid and accurate placement of the mask, and any additional devices pass through its integrated channels. As indicated on the airway tube, the AuraGain can accommodate up to size 16 French gastric tube and is designed for the easiest possible gastric tube placement due to the low-friction surface on the inside of the drain tube. The gastric channel is a safety feature designed to let fluids and gases escape and provides the ability to suction the stomach if necessary. The AuraGain can also be used as an intubation conduit for an optic bronchoscope. In combining these safety features with superior seal pressure, the Ambu AuraGain provides an airway which can be used confidently in a variety of cases, reducing the need for additional specialty devices. The AuraGain comes in 8 sizes, accommodating patients from infants up to adults. These sizes are based on the patient's weight and are subject to individual patient assessment. When preparing to use AuraGain, first choose the correct size mask based on the patient's height and/or weight as assessed by the caregiver. Once the proper size has been selected, it is important to pre-check the device before use. Perform a test inflation, looking for any pinhole leaks which may be present. Prior to insertion, it is recommended that the cuff be deflated until flat and unwrinkled. This can be accomplished by pressing the cuff down onto a flat, sterile surface while simultaneously deflating the device with a syringe. When deflating the cuff, squeeze the tip first and then deflate. Then, lubricate the mask on both the posterior tip of the cuff and the distal posterior side of the cuff, using a sterile water-based lubricant. When the patient is asleep, tilt the head back slightly into a partial sniffing position to allow insertion of the AuraGain laryngeal mask. Place your free hand under the patient's head. Insert the tip, pressing upwards against the hard palate to flatten the cuff against it. Push the jaw gently downwards with your middle finger to open the mouth further. Insert the mask by swinging it inward with a circular motion. Glide the mask along the contours of the hard and soft palate until a definite resistance is felt. Do not use force or hold the jaw open. With the AuraGain now in position, gently inflate the cuff to create a seal against the airway wall. The extra thin cuff material easily conforms to the shape of the wall, with exceptionally low intra-cuff pressure. This ensures an airtight seal. Once the seal is achieved, the AuraGain can now be attached to the ventilator. If indicated, the AuraGain may be secured using tape. The visual window in the airway tube allows for inspection of the ventilation process and serves as a way to monitor condensation buildup. During pre-ventilation, air may flow into the stomach, causing insufflation. Introduce the AuraGain mask and inflate as previously indicated to form a seal. Once the mask is situated, you may then insert the gastric tube if necessary, to allow decompression or suctioning of the stomach as needed. To use the AuraGain as a conduit for direct endotracheal intubation, it is recommended to use a bronchoscope for visual guidance. Advance the scope through the mask until reaching the navigation marks by the single-use only text. Then continue to forward the scope down the trachea to the carina. From this point, advance the ET tube down the scope through the AuraGain, then remove the scope and begin ventilating the patient. Note that the maximum size endotracheal tube the AuraGain can accommodate is also indicated at the end of the tube, just below the airway connector. The AuraGain can remain in situ after deflation, or it can be removed using the tube-to-tube exchange method. Upon completion of a procedure using the AuraGain laryngeal mask, simply detach the breathing circuit and any other connected tubing once the patient is awake. Once the patient regains their reflexes, then remove the AuraGain. If required, it is recommended to only partially deflate the cuff prior to removal. Once removed, all components should be disposed of in accordance with local guidelines.